for a lot of people who struggle with addiction, the addiction is there before the drugs come in. And what I mean by that is that, there's certainly plenty of people who in their teenage years or in their early 20s experiment with drugs who don't become addicted. For me, this addiction started very early. At the age of 8, in the middle of a panic attack, which at the time I didn't know was a panic attack, I reached for a bottle of pills that was in our medicine cabinet. It had been there a long time. It was an expired bottle of painkillers, which I didn't know what they were at the time. I just knew that there was a label on there that said may cause drowsiness, and I wanted that drowsiness. So that was the first time that I reached for a drug. From that point forward, I would pilfer pills from the medicine cabinets of my friends' parents, from relatives. And when I was 13 and adolescence was hitting, I tried heroin for the first time with my boyfriend.
And you went on to become a full heroin addict. And
Yes.
you obviously realized over the years that you had become addicted, and you tried to get clean several times. Why do you think it was so difficult for you to kick your habit?
I think that it's difficult, especially for people who haven't struggled with addiction, to understand why you can't just say no, or if you have negative consequences continually, why you can't stop. I think there are a couple of reasons. Obviously, with opiates like heroin, there's a physical dependency that occurs, which while you're in active addiction drives the addiction. But you wonder why people keep relapsing. There is what I call a shame cycle that happens. And this doesn't just happen with addiction, but this happens with all sorts of sort of self-destructive behaviors, where we have these belief systems about ourselves that often are formed when we're very young, that we're not good enough, that if people really saw who we were, that they wouldn't love us. That's sort of that base primal fear that if people knew this X factor, they wouldn't love me. I had that from very early on.
You are, thank heavens, now very firmly clean. How did you kick your habits?
Well, as in the book, as you know, and I speak about a lot, I relapsed, I don't even know how many times. I relapsed constantly. And I, at 28 years old, became pregnant, and it wasn't a planned pregnancy. Against all better judgment, I decided to have the baby, and I was using at the time. I found a doctor who was willing to detox me, because at the time what the protocol was to put pregnant women on methadone maintenance.
Yeah. There's a whole industry built up around the treatment of addiction and addicts. You talked a little earlier about the shame factor, and not enough perhaps is understood about the shame factor. Do we understand in 2021 enough about addiction?
No. I mean, of course, I think that there will still be more and more to uncover. That said, I think things are moving in the right direction. I think that globally, that there has been a shift in the way that public health policy addresses the issue and law enforcement addresses the issue. You've certainly seen this across Europe, and we're seeing this in the US now. I've sat on many panels with public health officials and law enforcement, and their policies have shifted away from punitive measures to helping people stay alive and access treatment. We still have a long way to go, but we're moving in the right direction.
The demographic for addiction has also changed dramatically. We've heard a fair few stories of young people, especially in the 60s, 70s, becoming addicted to drugs of various types. Today, the big problem is opioid addiction.
Yes.
And it's not necessarily young people, it's middle-aged people seeking fentanyl and prescriptions. And there's an opioid epidemic across America. That must be a very frightening epidemic.
I mean, it's very frightening. And part of the reason it's so frightening is that with these drugs like fentanyl, they're so much more potent than street heroin that people are dying at a much faster rate. And I think that when we look at treating addiction and treating the opioid epidemic, the very first thing that we need to focus on is keeping people alive, because people aren't going to recover if they're dead, right? That's the number one priority, which is why things like Narcan training, that's the drug that's used to reverse an overdose. Why Narcan training is so important. In most major cities in America, you can access Narcan without a prescription. I know many people who carry Narcan with them who are not struggling with addiction, but they do that in case they come across somebody who is in the middle of an overdose, which in a major city you often run into on the street. I've
But
seen people recover from places that you thought they could never recover from
But
because somebody.
what surprises me, I think,
Mhm.
Erin, is the demographic, that middle-aged people, middle-class people. You're not talking people living on the streets
No.
or disadvantaged people. You're talking quite well-off people for this opioid addiction. What has caused that?
I think there's a combination of factors. I think one thing that we're not recognizing is that I think that there were more people like me when I was using drugs than we knew about. And, a big part of the reason, the first 10 years of my addiction from 13 to 23, I hid it from nearly everybody in my life because I hid behind financial privilege. I hid behind being able, because of that financial privilege, I was attending prep schools, I went to a good college, I was a horseback rider, I had all these things sort of covering up what was going on. When pharmaceutical companies introduced new drugs like Oxycontin to the market, and they were really promoted to doctors as being, there was obviously we know about the lawsuits and the controversy that they were being promoted as being non-addictive and whatnot. There was a flood of opiates into the market that were finding their way to sort of like a new batch of people. But I think that we look at like, okay, so
Are
there
you
are
saying
people
this is
coming.
really sort of a hidden epidemic?
Yeah, and I think that part of it is, it's not just that they were prescribed an opiate. I think painkillers can be very effective. They're used to treat pain, but people who are struggling with addiction are using them to treat pain. They're using them to treat emotional pain. And it goes back to sort of, this, what we talked about earlier in regards to shame and sort of long-term aftercare. I think that, at the baseline of all of this is that we have globally a mental health system from country to country that is not very effective, and that we need to be looking at the mental health and well-being of people as equally important as their physical well-being.
That's a very good point. Erin Khar, many thanks indeed for joining us on The Agenda.
Thank you so much for having me.